Today I will demonstrate the complete restoration of tooth 26. This tooth has a very deep infiltration and has already been diagnosed for endodontic treatment. We will now begin with an infiltration of local anesthesia, lidocaine, in this case, so that we can open this tooth without any sensitivity to pain, with a tapered drill, removing all the old restoration there, right? It is infiltrated. Inside the tooth, we will find the decayed tissue already significantly affected by bacteria. We will curette this tooth, removing the decayed tissue manually and also with the motor. While performing asepsis and cleaning, we can largely remove this, making a slightly larger opening to locate the entrance of the canals, which is where we will perform the endodontic treatment. By locating the canals, we remove the decayed tissue. This is a procedure for probing to now remove the nerve, part of the nerve, and this is an intrapulpal anesthetic. It is necessary to anesthetize the part of the canals where live nerves are still present. We need to administer this anesthesia so the patient does not feel pain. Then the sequence of instrumentations begins. They are very similar, but they change the size of the file, and these files will work inside the canal, giving it an appropriate shape so that we can fill it. These files also completely remove the nerves, leaving the canal very clean, free of bacteria, and without nerve extensions so that the patient does not feel pain in the future. It is necessary to suction all the material, continuously irrigating with chlorhexidine and hypochlorite to wash and kill all the bacteria. Access to the canals was successfully achieved. We are carefully removing and checking for the presence of more nerves. Now drying the inside of the canal. Some steps were cut out because they are too lengthy. Now we are moving on to the drying procedure of the interior of the canal with absorbent paper cones. These cones do not stay there. They will only absorb the water and the hypochlorite that is inside the canal. And now, finishing the sequence with the Gutta percha cones. These are the materials we use for filling with endodontic cement. It reaches the apex of the root. Now we will cut the excess of the cones and condense these cones so that they fit and mold inside the canal. These cones are shaped and ready for the next sequence of treatment. Now placing the temporary filling material. This is a liner to prevent long-term contamination. We protect this canal with this material, preventing contamination. This is the second protective material, which is glass ionomer. It is also a lining material that promotes the sealing of the tooth, preventing future contamination and filtration. Now we perform the acid etching so that the restoration adheres well to the tooth. She opens the dentinal tubules. If you place a microscopic image, you will see that the tubules, the dentin walls are well opened and receptive. Now, to the next material we will work with, which is the adhesive. Drying is very important for the adhesion of the material. Now yes, brushing the adhesive so that it bonds with the resin. As you can see, the work is done correctly. It is unlikely that this tooth will experience infiltration in the future due to the number of protective layers we apply, even before the restoration, adjusting the resin in the incremental technique, which involves parts that are modeled and sculpted to achieve the exact shape of the tooth as it was originally following a linear color. For the tooth, this tooth has an A2 color, so we follow a sequence of body, enamel, and dentin resins, creating the cusps, the lobes, and sculpting grooves to provide better resistance and also aesthetics. The patient can eat better when the tooth is well sculpted. The food is crushed in a more appropriate way. It is a reconstruction of a tooth that was literally practically lost. For such treatment, it is necessary to use and prescribe medications so that the patient feels well. Additionally, there should be follow-up always, once a year, with radiographic examinations. Thank you for watching our channel and a big kiss. See you next time.